Hardin Memorial Health's Total Knee and Hip Replacement Program is the first in Kentucky to earn the Joint Commission's Advanced Total Hip and Total Knee Replacement Certification, the highest distinction from the nationally recognized accrediting body. What does that mean? Well, we know that when knee and hip issues reduce a person's quality of life, every step matters, and our team is committed to the highest quality care every step of the way.
Certification is always about being excellent and about always striving to be better. So when you think you've arrived, you still have more improvement that you can always do. And we wanted to pursue this program so that we could be the best that we can possibly be for our patients.
Our team takes a patient-centered approach to care. Our surgeons start with knowing our patients' goals and helping them every step of the way to achieve them.
We do teaching the entire time, and that's the key, because we know that if you just tell people one time, they have other things on their mind. We have so many people involved in their care and teaching. Social workers, physical therapy, the nursing assistants on 2 North, the nurses. It's constant reinforcement of that teaching where the patient won't forget, again, because it's a stressful time for them. And we want the patient's caregiver to be there as well.
We have a dedicated orthopedic team of nurses, surgical techs, and anesthesia providers that support our physicians and provide excellent patient care.
But this world-class care doesn't end once surgery is over. Thanks to our post-operative nursing and therapy staff, patients are up and moving within 120 minutes of surgery.
Once the patient comes back from surgery, they are here on our orthopedic unit, and we provide excellent evidence-based care. We have the most compassionate, caring nurses here. We have several long-term nurses that have provided excellent care through the years and love the orthopedic unit. Our ultimate goal is for our patients to be ready to go home with outpatient therapy so they can get back to their normal daily lives as quick as possible.
Ultimately, our goal would be to try to get folks into an outpatient setting. From a therapy perspective, it's where we have the most tools and equipment, and by having all those tools and equipment helps us get that patient the best outcome.
On top of receiving this prestigious certification, the Hip and Knee Replacement Program has also been named one of the top 36 programs in the country by Becker's Hospital Review. Every step matters, and HMH is proud to be the first program in Kentucky to provide the most advanced care at every step.